Good morning. Good morning, delegates. We kindly ask you that you take your seats so we can start the session and finish promptly at midday or hopefully earlier. We need a few more member states before starting. I ask the Secretariat if they can see if there are member states in the lobby and they can bring them in. Thank you. We will start. We have the necessary quorum now to start. Madam President, the floor is yours.
Muy buenos días.
Good morning to everyone. I hope you were able to rest. We have a wonderful sunny day today, and it's the last day. I'd like to remind you that we only have 2 minutes per statement, so we will now continue with the agenda. We'll begin with item 8.8. Plan of Action on Human Resources for Universal Access to Health and Universal Health Coverage, 2018-2023 Final Report. I would like to bring document CD 61/INF/8 to the attention of the Council, and I'd like to invite Dr. James Fitzgerald, Director of the Department of Health Systems and Services of the Pan American Sanitary Bureau, to come to the head table. Thank you. I yield the floor to the representative of the Executive Committee to report on this item. Thank you very much, Madam Chair. The Executive Committee was informed that most of the targets of the Plan of Action were not met, largely because of the required focus of attention on responding to the COVID-19 pandemic during the Plan of Action period for implementation. The final report, nevertheless, highlights some important areas of progress. The report also identifies lessons learned and proposed future actions in line with the policy on the Human Health Workforce 2030, which was adopted by the Directing Council last year. In the committee's discussion of the report, the efforts of member states to implement the Plan of Action while also dealing with the COVID-19 pandemic were commended, as was the Bureau's critical work on this matter. It was noted that advances have been made in several areas, such as on strengthening leadership and governance, capacity building, and continuous education plans for health workers. However, concern was expressed at the slow speed of progress on the development of the health workforce. It was suggested that there's a need for further cooperation with academia and other relevant sectors to develop the profiles of the health workers of tomorrow. Member states were encouraged to strengthen data collection and analysis on human resources needs across the region, so as to ensure that measures are better targeted and promote a more equitable distribution of healthcare workers. Attention was drawn to the challenges posed by health worker migration and its impact on the health service delivery and the achievement of universal access to health. Thank you, Madam Chair. This concludes my report on this item. Thank you very much, Madam Representative of the Executive Committee, for this report. I now invite the directing council to take note of this report and provide any comments it deems pertinent. And I open the floor to the plenary to begin the debate. I call on Paraguay. Thank you very much, Madam Chair. Paraguay would like to express its appreciation for the presentation of the final report on the Plan of Action on Human Resources for Universal Access to Health and Universal Health Coverage 2018-2023, as it appears in document CD 61 Inf 8. The lines of action described in the report are covered by the National Policy on Human Resources for Health in Paraguay 2020-2030. The key points are the gradual implementation of our national plan by prioritizing certain topics and as a support for the effort, and in our effort to achieve universal coverage. We also have a national committee to implement the policy with strategic lines that include strengthening and consolidating the guidance and governance of policies and strategic planning for human resources in health. In addition, it focuses on implementing and monitoring human resource policies, considering the various suggestions of the professional profiles, training, development, and regulation. Aware of the pending challenges, Paraguay joins the rest of you in a collective effort to strengthen human resources in order to achieve universal access and the universal coverage of health that we've dreamt of for so long. Thank you, Paraguay. I now call on the Dominican Republic. Thank you, Madam Chair. The Dominican Republic would like to express its satisfaction with the Plan of Action on Human Resources for Universal Access to Health and Universal Health Coverage 2018-2023 and highlight that we have established as a priority the development and implementation of a national policy on human resources in health and a national plan with the commitment to begin implementation in 2025-2026. Likewise, we have established as a priority the strengthening of the Ministry of Health as the governing body for healthcare, human resources, and establishing regulations on healthcare personnel. One of the main measures is the adoption and implementation of the healthcare career. Another key point of the Dominican Republic's agenda is the coordination with the educational sector to change training in health, including educational curricula to include interprofessional educational, digital skills, and other necessary skills. We highlight that we have undertaken the first census on human resources in healthcare. It's in process. It'll be done in January 2025. And the purpose is to have statistical data on the amount of human resources that we have in the country and how they are distributed. The report highlights the progress made in the period 2018-2023. And although most of our goals were not reached, it is encouraging to note that for all of the indicators, there was a significant improvement. The Dominican Republic recognizes and applauds the progress made and encourages regional organizations in the countries present to continue working to help us achieve the indicators. And we highlight the importance of working together on these strategic lines of action on the policy of healthcare personnel for 2030. Thank you. Thank you, Dominican Republic. I now call on the United States of America.
The United States appreciates the final report on the region's efforts to advance the Plan of Action for Human Resources for Access to Universal Health Coverage. We welcome the progress made in capacity building, strengthening leadership and governance for human resources for health, and partnerships with the educational sector to implement continuing education plans and leadership development opportunities for health professionals. We are also deeply committed to the ethical recruitment of and comprehensive protection against exploitation and trafficking, particularly of migrants and healthcare professionals, and encourage all member states to adhere to Articles 3 and 4 of the WHO Global Code of Practice on the International Recruitment of Health Personnel. The U.S. government, in partnership with PAHO and other partners, will continue to strengthen the health workforce in the region and continues to build upon achievements made under the Americas Health Corps that has trained nearly 263,000 health workers across 22 countries in the Latin America and Caribbean region since the launch of the Summit of the Americas in 2022. We encourage PAHO to continue working on strategies to address health worker migration and retention, and we are looking forward to the high-level meeting on migration and mobility of healthcare workers.
Muchas gracias, Estados
I thank the United States and call on Cuba. Thank you, Madam Chair. In Cuba, the availability and status of human resources has allowed us to humbly demonstrate achievements in the main health indicators and provided a satisfactory response to addressing COVID-19. Our national healthcare system has more than 400,000 workers, of which 80,700 are physicians, for a proportion of 8 doctors per every 1,000 inhabitants, 17,000 entomologists, 69,000 nurses and technologists, and those who have a degree. Cuba has 17 medical science universities, 37 medical faculties, 11 affiliates, where 12 careers are taught, 17 in expert technic and middle technic expert. We also have a National School of Public Health and the Latin American School of Medicine devoted to the training of low-income youth from Asia and Africa and Latin America. The Ministry of Public Health, as a guiding body, is responsible for the implementation, distribution, and location of human resources. Aspects such as migration and the complex economic scenario people are dealing with currently present challenges to keep the stability and availability of human resources in the sector. And this is an essential part of our state's priorities and the government's priorities. The health system has a program platform that identifies amongst its priorities the care for staff, strengthening skills, and improvement performance. It includes scientific progress and international collaboration. As part of the legislative timetable of the country, we have adopted and approved a new public health law, which supports a series of standards and will lead to updating the services and provide greater protection to health professionals and technical experts. Cuba reaffirms its support to this plan of action. Thank you. Thank you, Cuba. I now call on Jamaica.
Madam President, a health workforce adequate in numbers and competencies remains a persistent challenge. Jamaica has made some progress with ameliorating constraints related to governance and leadership, working conditions, and enhancing workforce capacity building. With PAHO, we are developing a 5-year policy and action plan for human resources for health. It is projected that this will be completed within this financial year. The Government of Jamaica has implemented various strategies to improve working conditions for healthcare workers, including rehabilitating and building of health facilities, improving compensation through the undertaking of a comprehensive compensation restructuring, which saw significant changes to the remuneration packages of several cadres of health professionals, and the creation of posts for all categories of health workers, allowing for conversion of contract staff to permanent posts. In addition, approximately 700 new posts for doctors were created as we progress with the implementation of our primary and secondary care reform strategies. We foresee the establishment of additional posts for other cadres to support expanded services. We take the opportunity to thank Cuba for the support it continues to provide to Jamaica. We also continue to explore bilateral agreements with Nigeria, India, and the Philippines to increase our workforce and increase capacity for training through rotation in specialist areas and engagement of nurse educators. To attract persons to health-related fields, in May 2024, the Ministry of Health and Wellness launched a $2.5 billion Jamaican Scholarship and Development Fund. Over 600 Jamaicans were awarded scholarships in August to pursue studies in health-related fields. Madam President, We must adopt creative solutions to this urgent matter, and we urge PAHO to create the platform for innovations to be shared, developed, and tested so that we can ensure an adequate workforce. Thank you.
Muchas gracias, Jamaica.
Thank you, Jamaica. I now call on the Bahamas.
Madam President, the Bahamas notes the Plan of Action on Human Resources for Universal Access to Health and Universal Health Coverage. The Bahamas is proud of its progress towards universal health coverage. Maintaining an available, qualified, and adequate workforce for functional and effective health systems and better responding to public health emergencies is critical to our UHC achievement. Globally, the health workforce gap has become wider. With a growing burden of non-communicable diseases, we do not have sufficient allied health workers, including behavior change and health promotion skill sets. Nor do we have enough doctors and nurses, particularly specialist nurses, to replicate and deliver health services and programs across 30 inhabited islands in our archipelago. Modes of care have evolved to appreciate the role of allied and non-traditional health workers in the health landscape. It is time for these health workers to assume a prominent position in our performance measures. Therefore, the Bahamas recommends that PAHO add an indicator under Objective 2.1 to capture these workers. COVID-19 underscored the need to achieve the objectives of the Plan of Action and highlighted planning for policies and regulations which contribute to a framework for interventions to be supported by quality HRH information systems, key for timely and effective responses at the country level. While COVID-19 highlighted the need for a plan of action for HRH, its impact also prevented the achievement of targets. To get back on track with the plan, the Bahamas is forging bilateral arrangements with other territories, exploring on-the-job upskilling opportunities, upscaling our national health cadet programs, and expanding eligible health disciplines for subvention scholarships funded by the government. We will also leverage better HRH planning and implementation success through a national HRH committee. These and other initiatives will be crucial to increase access for the population and achieve the UHC mandate. I thank you.
Muchas gracias.
Thank you, Bahamas. I now call on Honduras. Good morning. Thank you, Madam Chair. Honduras agrees with the progress report on action on human resources for universal access to health and universal health coverage 2018-2023, thereby reaffirming the commitment to implement strategies that improve access and universal health coverage. Honduras, under its current process of restructuring the health system and given limited resources, requests that PAHO WHO continue providing technical support so that we can continue to improve and develop the management of human resources in alignment with the development of our health service network. We also recommend continuing with the monitoring tool of the plan in the platform and observatory on human resources as a basis for annual measurements and keeping relevance. The national plan on health in Honduras has the challenge of managing human resources in health through strengthening the guidance and governance with a regulatory framework that encourages national policy for the development and management of human resources that are currently being built and for which PAHO has been fundamental in structuring us and developing this. Given the current gaps, we request through CONADU their support to strengthen the training of professionals in healthcare so that they may have access to greater training opportunities. Thank you very much.
Muchas gracias.
Thank you, Honduras. I now call on Brazil. Thank you, Madam Chair. Brazil recognizes the work done by the Pan American Health Organization in implementing the Plan of Action on Human Resources for Universal Access to Health and Universal Health Coverage 2018-2023. Generally speaking, we could identify that the goals established by this Plan of Action were partially achieved, which allows us to recognize the enormous effort made by our region. However, we also would like to emphasize that the situation described in the report is of great concern to us. For Brazil, the healthcare labor force is a key aspect of our effort to build resilient health systems, which means that we have to be prepared to deal with a new significant international emergence should it occur, which means that we're not coming close to the goal as we should be. It would be important for us to undertake an additional effort to resume this debate amongst the countries in the Americas, as we did last year with the issue of racism and health. So we would like to put on the table the goal of having a meeting in the Americas next year for the implementation of the Plan of Action on Human Resources, and hope this is considered appropriate by all member states. Thank you very much, Brazil, and I now call on Chile. Thank you, Madam Chair, and good morning. Chile would like to thank the Secretariat for the report presented and for the fact that we participated very actively in all aspects of the analysis and development of the strategy, and therefore we're very committed to its implementation. For our country today, the major challenge is strengthening the governance of human resources, and we've been working hard on this. Where we have made progress is in the condition, status, and skills of human resources. The significant improvement of availability of sectoral and extra-sectoral information on personnel, as well as the development of methodology for the planning of human resources in the healthcare field, have allowed us to develop and progressively implement a permanent system to have a scenario where we have demand and supply and reduce our strategy and develop strategies to reduce deficits. In the period we are analyzing, 2018-2024, our country has included a significant number of human resources to our sectors by significantly improving the density indicators. By December of 2023, Chile exceeded the goals scheduled for 2030 of 44.5 nuclear professionals per 10,000 inhabitants. And we have reached a total of 85 professionals per 10,000 inhabitants. Finally, we have action we have undertaken together with the education sector in order to respond the needs of our healthcare system. We have a national plan for training and retention of doctors and specialists that has allowed us to include a significant number of doctors in our network. We are grateful for this report, and we are available to respond to any specific questions. Thank you very much, Madam Chair. Thank you, Chile. I now call on Panama. Thank you, Madam Chair, distinguished delegates. We would like to express our appreciation for the presentation of the final report on the Plan of Action on Human Resources for Universal Access to Health and Universal Health Coverage 2018-2023. This plan has played a key role for the country in seeking good health and universal coverage. The strategic outlines and have led to the design of national strategies that have improved the health system throughout the country. In Panama, we have made significant progress through the implementation of the Plan of Action, highlighting the development of a national policy for the training of human resources in healthcare, which is part of our national health plan, and this has been key in developing strategies to strengthen the sector. Furthermore, the implementation of a training system for human health for healthcare workers has led us to develop strategies to better distribute healthcare staff. Another crucial aspect has been an increase in the public budget for healthcare personnel, ensuring more personnel in rural areas. and therefore closing the gap to make sure we have more equitable distribution and recognizing the improvement in salaries for specialists. The roadmap for improving healthcare personnel, the exchange of experience with other member countries of COMISCAS, will allow us to strengthen our national ability to train human resources with aspects that cover all comprehensive health care. In the personnel staff for 2030, we are firmly committed to coordinating policies and plans that will strengthen healthcare human resources, because we believe that this is one of our most valuable resources to move us towards universal healthcare, both in Panama as well as region-wide. Thank you very much, Panama. I now call on France. Thank you, Madam Chair, dear colleagues. France takes note of the final report and thanks the chair for this subject. The strengthening of human resources is one of the pillars of all health systems that make them accessible to everyone. Therefore, the Academy of the World Organization on Health in Lyon, which will be open in December of this new year under Tedros, has a budget to ensure quality training for all professionals in healthcare everywhere in the world. A group of friends has been launched in Geneva at the World Health Assembly in May last year to support this academy, and we've received supports from Qatar, Rwanda, Indonesia, France, and a number of other states who wish to invest in human capital for world healthcare, and we invite you to join this group.
Muchas gracias, Fran.
Thank you, France. On this point, we have a non-state agent that would like to give a presentation. I call on the International Federation of Association of Medical Students.
Thank you, Madam President. Distinguished delegates, the International Federation of Medical Students Associations supports the commitment and welcomes the final report of the Plan of Action on Human Resources for Universal Access to Health and Universal Health Coverage. However, we are saddened to see the gaps in meeting objectives that regard multi-sectoral policy, implementation, and human resources for health, workforce capacity, planning and investment in employment opportunities, and improving working conditions where barely 1/3 of the countries reach the targets. As medical students who will be working as healthcare professionals tomorrow, we cannot allow the stagnancy to persist and enter the workforce with existing shortcomings. Thus, we call on member states to reaffirm political commitments towards universal health coverage through well-implemented national policies that ensures the safety, well-being, and professional development of healthcare workers, implement mechanisms and initiatives to improve working conditions, increase academic and clinical opportunities, and prevent from brain drain of human resources for health, promote equitable staffing through the development of initiatives that ensures non-discriminatory frameworks so that each health worker can lead their careers as they want, no matter their gender, reproductive choice, race, ethnicity, and social status. Supports human resources for health in constant education that goes beyond clinical knowledge, but encompasses social determinants of health and fosters interprofessional collaboration. We work with civil societies, patients, the healthcare forces, and medical students organizations that ensure that aforementioned policies serve well. We want to make a strong and clear message to member states that it is time to fully comply with the medical oath through the achievement of universal access to health. And we, the youth, remain motivated to support you in the making in a reality if you engage us meaningfully. Thank you.
Muchas gracias a la Federación.
Thank you very much to the International Federation of Medical Students Associations for their statement. And now I give the floor to Dr. Fitzgerald to respond to these comments.
Thank you, Madam President. Director, Member States, very good morning to you. And thank you for your comments on this important final report that was presented here to the Directing Council this morning. I think really what we're hearing from you is the importance of health workforce, not just within the context of a capacity to be able to respond to an international public health emergency such as we saw in COVID-19, but really to develop capacity and resiliency within health systems and to be able to respond and ensure universal access to health and universal health coverage to all people, irrespective of whether they're living in a middle-income urban centre, a peri-urban centre with high levels of poverty, or in a rural area that has difficulties in terms of access. Our health workforce is really a key strategy to ensuring that no one is left behind in terms of access to health. However, we also heard that there are major challenges in the countries. The lack of availability of health workforce in terms of absolute numbers is a critical issue in the region. WHO has noted that we are essentially short 2 million health workers if we're to achieve 80% of SDG 3.8.1 by 2030. Now, this is an extremely important challenge, as it really means that member states will be faced with an enormous, with the effort to increase the generation and production of health workers in order to meet some of the core and basic indicators associated with the SDGs. And it's not just in terms of absolute numbers, but in terms of distribution, the regulation, the establishment of interprofessional teams, attrition, burnout, working conditions, all of these issues I think we're hearing very clearly from you. And as countries in the post-COVID-19 context are moving forward in the transformation of health systems based on primary health care, this issue will be probably the rate limiting factor in order for countries to continue the expansion of health systems based on primary health care. This includes, of course, the discussions we had yesterday relating to specialised care, emergency critical care, and indeed public health competencies relating to the essential public health functions. And so there's a broader context here that I think really highlights the importance of what a number of member states have said, Paraguay, Panama, in terms of the importance of developing intersectoral policies led by the health sector with the participation of labour and education. As Dominican Republic indicated, the analysis cross-sectoral of the status of the health workforce so that you can begin to plan and identify the numbers of health workers you need, where you need them, from the perspective of short-term, medium-term and long-term. Stewardship in this area is really critical. We heard from the Dominican Republic, Cuba and Chile how the Ministry of Health is assuming leadership of this issue. And it's important to note that some countries, as of yet, do not have formal structures within ministries of health to really guide policy development, oversee stewardship and ensure effective planning. And this is a very important issue, and we would really urge those countries to consider establishing those mechanisms with well-qualified staff that have the capacity to oversee policies, policy framework development and analysis in this area, because it will be a critical factor moving forward, but also because it represents the number one category in terms of public and current expenditure in health within your health system. And so just from the financial perspective also, this is a really important issue. The planning issue is really important as well. So translating the policy right down to planning, we've heard from Honduras, they're hosting the Comisco workshop on national health workforce accounts, labour analysis, intersectoral analysis of the labour context within the Central American region, and we thank Honduras for hosting that meeting. We currently have 35 countries now actively reporting in the national health workforce accounts. So we really appreciate the effort that countries are making in this regard. This has been a major initiative. We've gone from essentially 2 or 3 right up to 35 in a period of 7 to 8 years, which really highlights the importance that countries are placing on data, determining what health workers they need, where they need them, and then feeding into the policy and planning process. A couple of comments on migration that we heard from member states, which is a really critical issue. Particularly in the Caribbean, we note that COSOD also adopted a policy document on mobility and migration that sets out key strategic issues and areas that will be worked on in the Caribbean in order to not only recruit but ensure retention and mitigation of the impact of migration within the Caribbean, which is a particular challenge. We heard from the Bahamas in particular around specialized services, specialized nurses, but we also know this is a challenge right across the Caribbean. The United States mentioned the importance of the meeting that we're organizing on October 19th and 20th here. It's a high-level meeting, a high-level dialogue with our colleagues in the Euro office, with the participation of 5 important member states from Europe, destination countries for migration and health workforce, with countries from the Americas to begin to outline a roadmap that will ensure, on the one hand, that the Americas has the capacity to produce and retain health workers, while at the same time Europe has similar capacity, and there could be a more structured and organized mobility of health workers within countries and, of course, between regions. We noticed also that Jamaica and Bahamas are taking important steps, as many other countries in the Caribbean are, to ensure that retention strategies are in place, improving working conditions and planning mechanisms to maintain the health workers and to plan and program accordingly. It was mentioned the importance of the Code of Practice on the international recruitment of health personnel. And just to advise all member states that WHO will be taking this issue up next year in the World Health Assembly. And following the request of the director that was sent to all ministers in the country, we're pleased to report that we have moved from 4 countries now reporting on the International Code of Practice to 17, and we have an additional 3 countries in process. So this region will be very well represented in the discussions on the International Code of Practice at WHO next year. You may not see your data and the reports going into the document moving forward at the Executive Board, but we've been assured by our colleagues in Geneva that the data will be from the region submitted and included in the analysis moving forward to the World Health Assembly. Capacity building. Very appreciative of the support from the United States government, in particular from USAID on the Americas Health Corps, and we're very pleased to see the numbers for training and capacity building increasing in that area. Also, our thanks to France for the establishment of the WHO Academy, and just to inform all colleagues that our PAHO Virtual Campus will actually act as the regional hub for the WHO Academy in the Americas, as the director just recently signed an agreement with the Academy to establish the PAHO Virtual Campus as the regional hub of WHO Academy in the Americas. The PAHO Virtual Campus continues to go from strength to strength. We now have over 3.2 million health workers actively engaged and participating in the multiple training courses, over 50 training courses that are launched every year through the campus. And as the campus continues to innovate and modernize through geospatial analysis and distribution with various analytics in terms of the categorization of health workers, we really are generating data that allows us to be able to identify critical issues in terms of availability and distribution of health workers as we also move to increase capacity building. Finally, much of the issues also that you've addressed here this morning are contemplated in the policy document that you did adopt last year, the Health Workforce Policy 2030 for Resilient Health Systems. So we will now use that framework to move forward with the 5 strategic lines of action, including the request for additional data from Bahamas will be included in the midterm reporting and the final reporting on that issue. Thank you very much, Madam President.
Muchísimas gracias.
Thank you very much, Dr. Fitzgerald, for responding to these comments. Director, any comments? Yes, Madam Chair. Good morning. First of all, I'd like to thank the member states who shared their experiences of progress made, as well as the challenges in connection with this final report on the Plan of Action on Human Resources for Universal Access to Health and Universal Health Coverage 2018-2023. As you rightly pointed out, and in connection with the presentation that was made on the final report, there's still many tasks to be carried out on human resources. And that is why last year you approved a resolution on human resources. And now this is our guide for our activity on how to strengthen the countries in dealing with such an important topic. James Fitzgerald has rightly highlighted the challenges that we faced in terms of the deficit that exists in human resources that could reach up to 2 million professionals by 2030, but also in connection with the inequitable distribution of those professionals in the different countries, and also in connection with another issue. Many a times we don't have the professionals with the necessary skills that are needed today. How many primary health care teams that we have in the region are ready in order to provide this variety of services of what we call the renewed and strengthened health care that goes from prevention, surveillance, care, paying attention to non-communicable diseases, communicable diseases, the elimination of diseases, so that broad package in order to respond to the complex epidemiological scenario that we have in the region. So we have many challenges aside from the issue of migration, which is always a significant challenge faced by countries in the Caribbean, but also in other countries. It starts also becoming an important problem to which an answer must be found. So I believe that we have to continue working with the new resolution that was adopted, and I thank Brazil for their offer in hosting the meeting. I believe that it could be very important, first and foremost, to draw the attention, to renew commitments, but also to share experiences. I believe that there are many interesting experiences in the different countries in terms of production, training of health professionals, and I believe that undoubtedly this meeting could become an important platform in order to share those best practices that countries have and to further reinforce our commitment with human rights. So we will coordinate with the Ministry of Health of Brazil so that we can hold that meeting in 2025. Thank you very much, Madam Chair.
Muchas gracias.
Thank you, Dr. Barbosa, for your comments. I would like to inform the Council that the debate will be noted in the final report. We now move on to the next agenda item, item 8.9, access and rational use of strategic and high-cost medicines and other health technologies. A final report. I bring to the attention of Council document CD 61, Inf 9, and I invite Ms. Judith Rios San Juan, Director of the Department of Innovation, Access to Medicines and Health Technologies of the Pan American Sanitary Bureau, to please come to the head table. Welcome, Doctor. I give the floor to the representative of the Executive Committee to report on this agenda item. Thank you very much, Madam Chair. The Executive Committee was informed that member states have made progress in developing and implementing policies and strategies for enhancing access to health technologies, many with a focus on the prevention and control of cancer and rare diseases. Progress has also been made in establishing mechanisms for the incorporation of evidence-based health technologies and health systems, in developing national consolidated procurement strategies, and in using regional joint procurement mechanisms such as PAHO's revolving fund and strategic fund. In the discussion of the report, the importance of promoting regional production and equitable access to medicines and other health technologies was emphasized. Attention was drawn to the successful use of PAHO's revolving fund and strategic fund to gain access to affordable pricing for medicines and health technologies. The Bureau was encouraged to strengthen the joint procurement process and facilitate dialogue with the pharmaceutical industry in support of affordable pricing for medicines and the vaccines in order to ensure consistent access for the region's populations. Thank you, Madam President. This concludes my report on this item. Thank you very much, distinguished representative of the Executive Committee, for this report. And now I invite the Directing Council to take note of this report and provide any comments it deems pertinent. I open the floor to the plenary to begin the discussions.
Cedo la palabra.
First, let me call on Brazil. Madam President, access and rational use of strategic and high-cost medicines as well as other health technologies are important and necessary. Brazil believes that we need to change the status quo, decentralizing the concentration of knowledge. We can no longer perpetuate a structural business, production, and technology model that reproduces asymmetries to technological access. The COVID-19 pandemic showed how much Central America and Latin America and the Caribbean are dependent on importing health technologies and exposed the vulnerability of these world and global change. In order to promote innovation, local manufacturing, regional production, and local production, that is essential in order to face health pandemics and other priorities. That vision includes the need for increasing access to high-cost technologies stemming from one source or of limited availability. Guided by that spirit, Brazil proposes on our chair, our G20 coalition, production for innovation and equitable access, local productions concentrating on access to vaccines, treatments, diagnosis, and other health technologies. The coalition, if it were to be approved, will act through concrete projects concentrating on diseases and various conditions, the promotion of resilient technological platforms, and expand access to health technologies that are relevant. Developing countries will be better prepared in order to adapt to this production if it were necessary in cases of health emergencies. Brazil reiterates its interest in order to develop a new policy of PAHO that can be considered and approved this coming year on the issue of strategic and high-cost medicines and other health technologies. The policy ought to be expanded, strengthened, updated, and to be closer not only to the needs for local and regional production, but also the need to promote equitable access in the Americas. Thank you.
Muchas gracias.
Thank you very much, Brazil. And now I give the floor to El Salvador. Thank you very much, Madam President. El Salvador welcomes the report submitted at the same time that we agree that we have to decentralize in a better way the procurement of high-cost medicines and those of difficult access. We know that diseases that require high-cost medicines are increasingly more difficult to be able to obtain for each one of the countries. Therefore, we thank PAHO that has played an essential role in being able to move forward in this area, not only on that, but in the procurement of health technologies that allows for the resilience of countries such as ours. At the same time, we also acknowledge that the country has moved forward on regulatory issues, having a regulatory agency of level 4, which has also been thanks to the support of technical cooperation of this organization.
A su vez, reconocemos
We also acknowledge the importance of developing greater markets, of opening up or getting to know about additional markets in order to have better access to medicines that many a times for these rare diseases, they're increasingly more difficult to obtain. Thank you.
Muchas gracias, El Salvador.
Thank you, El Salvador. And now we give the floor to Panama. Madam President, distinguished delegates, I welcome the opportunity to speak on behalf of Panama, and I'd like to express our sincere gratitude for the report presented on access and rational use of strategic and high-cost medicines and other health technologies. This report provides a valuable vision and contributes in a significant way to our discussion on these crucial issues. Since January 2023, taking as a reference the Law 109, which creates a national law on medicines, we've made progress on the development of a comprehensive policy to regulate and promote the rational use of medicines, stressing the promotion of pharmaceutical participation in programs such as the program on optimization of antibiotics.
Hemos fortalecido nuestra capacidad local mediante
We've strengthened our local capacity of our law in 2024, which promotes the use of sera and antidotes, ensuring access to essential products.
Hemos unificado los listados de medicamentos
for vulnerable communities. We've beefed up the production of local medicines in order to ensure effectiveness, efficiency, and security. We expanded the basic basket of medicines, and we created the National Observatory of Medicines in Panama to improve transparency in marketing and supply. It also establishes the national system of reference prices that collects the need for procurement at a local level, and the national negotiation as well as international negotiation using scale economies, the most favorable reference price for the processes of local procurement in the country.
realizan compras de medicamentos
Likewise, procurement of medicines is done between the Social Security and the Ministry through a process that is known joint procurement of medicines, where both institutions select common medicines, and they have the convening of RFPs through one single process. We're also implementing the National Comprehensive System of an Electronic Prescription to optimize the management of medicines and timely access of these medicines. Panama reaffirms its commitment with the commitment of policies in order to ensure accessible use of medicines aligned with what is proposed by Bajo and ratifies what appears in the report. Thank you.
Muchas gracias, Panamá.
Thank you very much, Panama. Now we give the floor to Bahamas.
Madam President, the Bahamas acknowledges the final report, which presents critical policy options and strategies to enhance access to and rational use of high-cost medications and health technologies. We commend the achievements of member states and recognize, like many of you, the Bahamas faces similar challenges outlined in the report. In light of these challenges and the rising demand for safe, effective, and quality medicines, the Bahamas is actively restructuring its regulatory framework to develop a more mature and resilient system capable of managing the evolving complexities in healthcare. We are also finalizing an updated national essential medicines list to ensure that priority treatments are accessible and affordable to our population. The Bahamas is committed to regional initiatives, including the PAHO Revolving Fund and Strategic Fund, which have proven effective in reducing the cost of critical medicines and vaccines. We have increased our engagement with these mechanisms and encourage other member states to leverage this procurement resource for financial savings and improved access to high-cost, essential medicines. COVID-19 revealed the region's reliance on imported health technologies, prompting the Bahamas to explore local manufacturing and innovation. The Bahamas promotes therapeutic interchangeability and the use of generic multi-source medicines to ensure cost-effective treatments. Through rational prescription practices, the country aims to manage healthcare costs, safeguard financial protection for its population, and reduce out-of-pocket expenses for high-cost treatments. Madam President, the Bahamas supports the actions outlined in the report, particularly the call for comprehensive multi-sectoral access policies, transparent legal frameworks, and enhanced regional collaboration. We remain fully committed to achieving these shared goals to strengthen health systems across the region. I thank you.
Muchas gracias.
Thank you very much, Bahamas. And now I give the floor to Cuba. Thank you, Madam President. We are convinced that self-sufficiency in medicines and health technologies ought to become public policies. Therefore, this moment of regional thought should concentrate on the integration and cooperation in order to develop common proposals and to achieve equitable access to pharmaceutical products that are effective, safe, and of quality. In Cuba, public health is a right of all people, and it is a responsibility of the state to ensure access, free offer, and quality of services. The company Bico-Pharma, that is responsible for the production of 62% of medicines used in our national basic schedule, has 45 companies, 110 lines of production, 20 units of science and technique, with over 19,000 workers, of which 1,200 are women and 250 are PhDs in science, and the others are masters. We have lead products coming out of the market specifically to deal with cancer. Cuba developed 5 vaccines that were candidates against COVID-19. 3 were approved as a vaccine, which enabled us to launch a vaccination campaign without precedent with immunization of over 98% of the Cuban population older than 2. Our pharmaceutical industry saved Cuba from COVID-19. Cuba possesses a center for state control of medicines, equipment, health technology, SECME, a Cuban regulatory authority that ratifies every day the firm commitment that we have to continue protecting the health of the population and which maintain its condition as a collaborating center of PAHO, WHO, for the regulation of health technologies. Cuba makes available to PAHO and offers to countries in the region its full technical capacity and experience in the production of medicines, biotechnological products, and vaccines, as well as the strength of our regulatory agency, and it is all made available to all countries in the Americas. Thank you.
Muchas gracias, Cuba.
Thank you very much, Cuba, and now I give the floor to Argentina.
Muchas gracias, señor.
Thank you, Madam Chair. Good morning, everyone. Argentina thanks you for the report and particularly thanks the work PAHO has done in the last few months to provide us with a tool and a strategy for joint procurement of medicines and reach greater access. Access in the last few years has been one of the main issues discussed. It's a major problem in helping our populations access a state of good health. Right now, we understand, and I'm going to use a football team, the ball is on our court. It is us, the countries, who now have to decide how to play the best game possible. Thank you very much, Madam Chair.
Gracias.
Thank you, Argentina. I now call on Costa Rica. Thank you, Madam Chair. This is a strategic line. Really, all the countries are involved, and we need this 200%. Costa Rica is working on policies and coordinated strategies to improve the medicine stock. Since our arrival in July, we updated the whole therapeutic formula nationally to have greater access to 1,000 medications through the national health care, which did not exist for more than 20 years, and for which now Social Security has access to improved medicines for optimal treatment and relevant treatment. Unfortunately, the out-of-pocket expense has increased in the private market because of certain existing monopolies. And this is something that the strategies that are aligning themselves right now, we have to combat. And Brazil, Costa Rica, of course, supports this coalition for the regional production of medicine. To have equitable access to medicine in the Americas, it should be one of the main strategic lines for all of us, and it is my government's. The joint procurement of high-cost medications, the opening of markets to improve markets, tracing platforms to understand the management, and why not have regional regulatory authorities to avoid red tape and achieve real regulation in the countries that is standardized, that is supranational, and therefore improve our effort. Costa Rica is very interested and will support 100% this level of work. Thank you very much, Costa Rica. On this point, we have one non-state agent that wishes to make a statement. And I now call on the Latin American Federation for the Pharmaceutical Industry. Thank you, Madam Chair. Befi Farma, the Latin American Federation for Pharmaceutical Entities, and IFPMA, the International Federation of the Pharmaceutical Industry, recognizes the importance of achieving greater access to strategic medication. And we'd like to highlight 3 points. First, healthy population is key to economic growth and sustainable development. For this, it's crucial to have investment in health systems. The World Bank, according to the World Bank, Brazil is the country that invests most in health in Latin America, but is still less than Portugal, which has the lowest level in Europe. So we need to see health as investment, not expenditure. Secondly, we need to have a mature regulatory system. The report shows that 8 regulatory reference authorities still need to adopt continuous improvement plans in order to be recognized by WHO. Also, 40% of member states do not undertake all the activities or regulatory functions that are recommended. So we need to strengthen the system by the use of international standards. And finally, we have to prioritize clinical research. This has benefits in 3 areas: the health of patient, access to medical innovations, and increase in medical growth, and it brings well-being to the countries. It's important to understand the role of productive corporations that are solid. Let's work together to develop more efficient health systems that ensure access for better medication and improve the quality of life of all Latin Americans. We're available to collaborate in this shared mission and therefore build a more healthy future for the rest of Latin America. Thank you, the Latin American Federation of the Pharmaceutical Industry, for your comments. I now call on Mrs. Rios San Juan to respond to the comments. Thank you. Thank you very much. Thank you, Brazil. Thank you to El Salvador, Panama.
Muchísimas gracias a Cuba, Argentina.
Thank you, Cuba, Argentina, Costa Rica, and PHARMA for your excellent interventions. I think what we've heard is that this is a priority topic for all of those who've spoken today. I also would like to thank the countries in the region for their extensive participation in the consultations we had in preparing this final report. What we've heard is that inequity in access is a priority to all of you, as it is for the Pan American Health Organization. The vision of Dr. Jabez Barbosa to create in 2023 a new department within the organization to strengthen and innovate in technical cooperation within the area of innovation and access to medicines and health technologies has been endorsed by the responses I'm hearing from all of you today. I've heard that access inequality goes beyond the inequalities that we suffered under COVID-19. Inequality and access are a continuous reality in our countries, and which the health systems are trying to overcome in the region. We've heard a great alignment on many of the topics that have been introduced in the final report. The importance, for instance, of a comprehensive approach in public policies that goes beyond the traditional response. It's a much more ambitious approach, a more comprehensive, integrated, that addresses all the life cycle of health technology, from research to manufacturing to the regulatory process to the use of evidence and information when making decisions. We've also heard that there are different problems in different countries and different technologies, but that access to strategic technologies, specifically high-cost and technologies, are a priority and a common concern for many of you. In preparing this final report, as it said in the report, we not only looked at the experience of the region, but we also wanted to learn from the regional offices of the World Health Organization and other regions, so we consulted them, and we also looked for a globally and publicly available information. And the message that I'd like to bring to you is that this is a global challenge. We're not alone in this region in having difficulty to access to high-cost technologies, but the challenges in our region are particularly problematic, particularly when we see that some of the global or regional initiatives, many of the countries of the region are not included. This week, for instance, we had news about a very important initiative to increase access to a technology that's potential for protecting HIV/AIDS, and most of the countries in the region have not been included or given access to their technology, nor as producers of the technology. And yet, in our region, we do have productive capacity, regulatory capacity, and public policies that would allow us. So the message in the final report, and I hear the consensus from all of you, is that we have to be innovative in our public policies, and we have to expand our technical cooperation from PAHO. It's also clear that this is not work that can be done alone by the Department of Innovation and Access to Health Technologies that I have had the honor of leading for the past 10 months. It's a responsibility of the entire organization, and the joint work using revolving funds and working with technical departments, particularly where we see that there are greater problems of access, for instance, in the area of cancer or therapies where there's innovative technology using genetics, or even in antimicrobial resistance problems. I can only think of it in English, antimicrobial resistance, where we see that there's new antibiotics coming to the market, and they've become high-cost technology. So it's not just a problem of new technologies. We also see that longer-lasting technologies in the countries, for instance, insulin, where we've had 20 years since it was discovered, where the prices are way too high in the region. So I think a comprehensive, integrated, ambitious approach over the entire life cycle of technology is what I've heard from you and what we want to do at PAHO. To conclude, I wanted to reiterate the political commitment that this appears in the final report, but this afternoon we will be presenting a new draft resolution, a public policy, thanking Brazil and Uruguay for their policy to strengthen this technical cooperation with PAHO and reiterate our commitment at the highest professional and staff level to not let you down in our search to innovate in technical cooperation. Thank you. Thank you, Mrs. Ruiz San Juan, for responding to your comments. Mr. Director, do you wish to say something? Yes, Madam Chair. Thank you. I think this is a very important topic. And with the progress we've had in the region and views countries have shared, have all underscored how the need to have a better coordinated response on this issue exists. As has been said, we will share this at the meeting of the Executive Committee that will take place following the close of the Directing Council meeting. There we will be approving the agenda items for the next year. And one of the topics will be exactly access to high-cost, high-priced medications, which is a problem for all countries in the region. I think that many of you have spoken about the main issue, for instance, on regulation. We have to make an effort to ensure that the regulatory authorities of the region are strengthened and submit to evaluation using the global WHO tool. Because if we don't have that, we're going to continue with just 2 regulatory authorities in the region that are at the highest level of that assessment, Canada and the United States. I congratulate Canada and the United States for having achieved this, but I think in Latin America and the Caribbean, through effort and technical cooperation that we can provide to you, we can, by 2025 and 2026, have more regulatory authorities achieving that level as well, the highest level. And that's extremely important because in order to strengthen production, regional production in Latin America and the Caribbean, the regulatory issue is of great importance. To be able to produce products and export them, to have the highest rating is key. So we're working with regulatory authorities to support them in a process of self-evaluation using the same tool used by the WHO so as to identify any gaps that may exist and then support that country in developing and implementing a plan of action to respond to those gaps that have been identified. So I now invite you, all the countries, to verify as much as possible how can we move forward more quickly in this area. Of the 35 countries, only 2 in the region, only 2 have the highest level of regulatory authority. And we want that for all the regulatory authorities in our region. I would now like to thank Mexico as well for having been the host for our Parsi network, which is the oldest regional network for harmonizing and regulatory convergence. We had the 25th anniversary of the Parsi network meeting, and I think that we need to move faster in harmonizing and bringing about convergence in the reliance and inter-reliance of the regulatory authorities. There's a lot still to be done in that area. Also in the area of assessment and in including new technologies, very often it's difficult for countries because of our judicial structure and legalization structure. On the issue of regional production, as Judith said, we need to move forward in developing a regional platform, using existing initiatives and seeking new ones. But as the delegate of Argentina has said, the ball is now in our court, and we have to now learn how to play with that ball. Now we could take a significant step, which is to use the joint procurement mechanism, which is already in existence. We shouldn't fool ourselves. If we don't have a regional market, we're not going to have sustainable regional production. We had the CDC of Africa 2 weeks ago here, and they chose to come to Pajo because they want to learn from our experience. And there's one difference with Africa, between Africa and us. There are some producers who are setting up in African countries. And what's their challenge? If they begin to produce a vaccine in Rwanda, say, they have to go to South Africa, Ethiopia, Mozambique, Angola, each one of the African countries, the 54 countries, to be able to register that vaccine. Here, we don't need to do that. Here, since the countries changed their laws and regulations, a vaccine offered by the fund can be acquired by all of the countries in the region. That's one of the technologies that the African CDC wants to have. And I think this has been, in fact, strengthened in the region. The meeting we had on joint procurement, which began through the Mercosur countries, and I thank the Mercosur countries for their leadership, and Uruguay, which is the pro tem chairman, that is of interest and could help all countries in the region, the Caribbean, Central America. So if we begin through the joint procurement of medications of high cost, high prices for the 5 diseases that were selected, that could strengthen our own ability for regional production, because some of those medications do have production in the region. And if the production meets the quality criteria that the funds require, then the producer could feel more comfortable in making an investment in their production to increase it and meet the needs of the regional market as well. So I do think it's possible to have that synergy between creating and building a solid regional market and at the same time strengthening the production we're talking about, the high-cost medications that could be used for everyone, for the medical teams that exist in many countries in the region, including Costa Rica, which the Vice President mentioned. So I do think that we need to and can move forward at a faster pace. So we are highly committed and to support this issue, because with the epidemiological change, the demographic changes, and the new technologies, the health systems in the region have to be much better prepared to respond to those challenges. And we do have one advantage in the region, which we cannot ignore. So I'm going to make a direct invitation to the countries that have a large population in our region. And here I mentioned directly Brazil and Mexico, Argentina, Colombia. I invite those countries, and some are already using the funds. But if they join that initiative of producing high-cost medications, they will benefit all the countries in the region, because the price is tied to volume. For instance, the negotiation we're doing right now for the syncytial virus, RSV virus, which is one of the main causes for death in infants today and elderly. Children, it's a very high reason for death. If we have more than 1 million doses, there's a reduction of 10% in the cost per dose, which is already below the average procurement cost for the countries that already have begun using the vaccine, such as Chile, for instance. So I think that's one very specific, very concrete way of demonstrating solidarity and of creating a regional market that can develop and support regional production in the countries in our region. So thank you very much. My apologies for taking so much time. It's just, since the ball is now in our court, we have to make a goal and we have to win the game. Thank you.
Excelente intervención.
Thank you. Excellent statement, Doctor. I'd like to inform the Council that the discussion will be noted in the final report. We now move on to the next item. Let's move on to the progress reports and technical matters. These reports will be grouped in order to speed up the meeting. Delegates will be able to make their comments on each item. So the reports to be presented are the following: 810/8 to address the causes of disparities in health services access and utilization of health services for lesbian, gay, bisexual, and trans persons, a progress report. Then 810B, which is the roadmap for the digital transformation of the health sector in the region of the Americas, progress report. And 810C, strategy on health-related law, progress report. I'd like to draw the attention of the document, CD 61 INF 10A, also CD 61 INF 10B, and CD 61 INF 10C. And I invite Director Escaman, Director of the Department on Social Determinants and Social Determinants for Health Equity, and Dr. Sebastian Garcia Saizo, Director of the Department of Evidence and Intelligence for Healthcare Action, to come to the main table. I now call on the representative of the Executive Committee to report on these items. Thank you, Madam Chair. I'll begin with the first item, 810A, addressing the causes of disparities in health services access and the utilization for lesbian, gay, bisexual, and trans persons of healthcare services. Progress report. The Executive Committee noted that the progress report contained useful information on the health of a population that often lacks visibility and encouraged the Bureau to continue providing member states with updated information on the progress made and the challenges that remain in addressing disparities in health services access and utilization by lesbian, gay, bisexual, and trans persons. It was also stressed that all persons, irrespective of their sexual orientation or gender identity, should be safe from violence and able to access and receive health services. Member states were invited to continue their efforts to implement the recommendations contained in the report. It was suggested that the use of indicators might be helpful in identifying gaps and tracking progress. Thank you, Madam Chair. I've concluded my report on this item, Madam Chair. Let me now move on to 810B, roadmap for the digital transformation of the health sector in the region of the Americas progress report. In the Executive Committee's discussion of the progress report, member states reaffirmed their commitment to the digital transformation of the health sector and commended the report's focus on critical aspects of that transformation, including equity, inclusivity, interoperability, and artificial intelligence. Digital solutions were considered crucial to achieve universal access to health care. It was stressed that the digitalization of the health sector must benefit all sectors of society, leaving no one behind. The need to work with indigenous populations to improve access to high-quality, culturally relevant health services was highlighted, as was the need to advance digital health literacy and address the gender digital divide. This concludes my report on this item, Madam Chair. 810C, Strategy on Health-Related Law, Progress Report. The Executive Committee reviewed the progress report on the strategy on health-related law during its June session. It was recalled that the strategy had been formulated in response to the challenges faced by member states in creating, implementing, and revising their legal and regulatory frameworks, and in establishing closer coordination between health authorities and the authorities in other branches of government. Member states were assured that the Bureau would continue to provide them with technical cooperation and support in strengthening their health-related laws and regulations. Thank you, Madam Chair. This concludes my report on this item. Thank you, Madam Representative of the Executive Committee, for the reports presented. I now invite the Directing Council to take note of the current reports and make any relevant comments. I open the floor to begin the discussion. If your intervention refers to a report, please indicate to which report you're referring before your statement. I now invite the United States of America to take the floor.
Hi, good morning. Just a point of, can we present more than one paper, or are we only presenting on A, B, or C at this time?
Sí, puede presentar.
You could present the three, but I ask you to please limit the time allotted.
Thank you for that clarification. I will begin with agenda item 810A, please. The United States thanks PAHO for the progress report on addressing causes of disparity in health service access and utilization for lesbian, gay, bisexual, and trans persons. We remain committed to promoting and advancing human rights of lesbian, gay, bisexual, and transgender, queer, and intersex persons in the United States and around the world. Everyone should be able to access and receive evidence-based health services, including sexual and reproductive health services and prevention care for HIV and other STIs, free from violence and discrimination, no matter their sexual orientation, gender identity, or sex characteristics. We remain deeply concerned about the recent trends to target LGBTQI+ individuals and threaten their human rights. As a region, we must stand behind our commitments to equity and inclusion while working together to combat misinformation and discrimination. Laws and policies that criminalize and stigmatize LGBTQI+ persons and persons living with HIV contribute to stigma, discrimination, and ultimately result in worse health outcomes. The United States is dedicated to pursuing an end to HIV criminalization, violence and harassment, discrimination on the basis of sexual orientation, gender identity or expression, or sex characteristics. We provide technical assistance to healthcare providers so that they may provide unbiased and compassionate care to LGBTQI+ patients and their families, and will continue to work with like-minded partners and allies on those actions and support meaningful inclusion of LGBTQI+ individuals. And if you may, I have a few points on agenda item 10C. The United States appreciates the progress report on the strategy of health-related law. We recognize that laws underpin and can impact our ability to address important health challenges. Appropriately drafted legal frameworks can make the difference between our success and failure. Legal preparedness facilitates an effective and timely response to public health emergencies by ensuring that legal capacities exist and potential issues across legal instruments have been resolved in advance. With effective legal preparedness, and more resources can be reserved for public health, communication, and scientific dimensions of the emergency prevention and response. Legal preparedness minimizes the need to develop new legal instruments under emergency conditions. Thank you.
Muchas gracias.
Thank you to the U.S. I now call on Panama.
Señora Presidenta.
Good morning, Madam President. The Republic of Panama welcomes the document presented in connection with the legislation on plans health-related laws. We've improved the norms and laws in order to ensure comprehensive health care for the LGBTQ population through the enforcement of rules and guides emphasizing key populations at a national level in connection with capacity building and training, cooperating with higher education in order to include the content on LGBT persons in the academic program for universities as a country and as a region. We believe that there's still some barriers that we have not been able to overcome, and therefore we ask this directing council to support countries with advocacy in the education sector. In the framework of access to services, Panama has strengthened the health care system to provide services that are accessible for all people, including the LGBT population, by opening friendly user services for key populations. We believe that it is essential to strengthen the analysis in health of LGBT persons in the region of the Americas and to increase the service of differentiated services for transgender population. Therefore, we urge PAHO and WHO to provide technical support to the countries in the region with best practices and a comprehensive approach of transgender persons and to replicate this model in major countries. Panama welcomes the report submitted by the Secretary of PAHO, submitting a substantive advance in order to deal with the disparities in health services access and utilization by lesbian, gay, bisexual, and trans persons. And we're very grateful that they be considered, taking into account our requests. Thank you. Thank you very much, Panama. And now I give the floor to Brazil. Thank you very much, Madam President. I will make a statement on these items 8.10a and 8.10c. In connection with 8.10a, the Ministry of Health of Brazil has improved public policies in order to take care of the specific needs of these persons, in order to improve the quality of health data of the LGBTQI+ persons. The Ministry of Health in 2024 updated its summary of individual registration, primary health, recognizing the diversity in sexual orientation and gender identity. Aside from this, looking after combating discrimination and criminalization that is also promoted through educational products created by the ministry. PAHO has supported the progress made at a national level, and we are certain that we will continue working, expecting that our region will move forward on public policies that can ensure timely access and of quality to different health services that will be provided to LGBTQI+ person. in connection with agenda item 8.10c. In order to ensure progress reports on technical matters and health-related law, we need effective governance, sustainable elements that will reduce inequalities, training of health professionals, and the protection of data of citizens to establish a joint path based on cooperation between our countries, which might entail significant progress in digital health. Thus, I wish to stress areas that could be developed together in our region. In digital health solutions that are financially accessible and scalable that will benefit vulnerable populations first. Second, digital infrastructure, public regulated infrastructures that will ensure confidentiality and protection of health data. 3, digital tools on health adapted to the local and cultural unique situations to improve the quality efficiency of health services. 4, cooperation, intersectoral cooperation for the development of digital innovations. And 5, digital health strategies that are integrated and part of combating inequalities in the region by using technology as a tool in order to promote equity and access to quality health services. Thank you very much. And Brazil is going to submit the complete interventions by email. Thank you very much, Brazil. And now I give the floor to Bahamas.
President, agenda item 810B. The Bahamas welcomes this progress report on the roadmap for the digital transformation of the health sector. As we have experienced notable success in each of the domains listed, we take this opportunity to share some of our progress. Work is ongoing to ensure that there is suitable bandwidth and connectivity through the use of fiber optic cables to at least one major health center in each island across the Bahamian archipelago. This is necessary to support telemedicine consultations with patients and providers and for transmission of remotely obtained digital X-rays and ultrasound images. The Bahamas is a recipient of PAHO's all-in-one telehealth platform station equipment, which is expected to be operationalized later this year. The plan for this equipment is to provide greater support for the nursing staff in certain communities, even as we redouble our efforts to increase our physician complement. The Bahamas has participated in valuable regional meetings aimed at sharing ICT experiences and looks forward to ongoing collaboration and networking, inclusive of the exploration of the exchange of data across borders. The IC team has engaged a legal expert to review legislation promoting health information governance and strengthening legal frameworks for equity. There is significant interest in using artificial intelligence for managing and analyzing health information, with efforts to raise awareness about its challenges and benefits. The Bahamas is collaborating with the National ICT Department and the Cybersecurity Incident Response Team to ensure the health information system meets cybersecurity standards. An active procurement exercise is exploring software for implementing a public health digital surveillance system. Even as we reflect on these achievements, we have in our sight additional actions that will propel the Bahamas and the region collectively further along the road to digital transformation. Thank you.
Muchas gracias.
Thank you very much, Bahamas. And now I yield the floor to Honduras. Thank you. Honduras suggests to PAHO to continue supporting countries in order to strengthen access of health services without discrimination and to be able to beef up information systems in order to include data disaggregation, which will enable us to typify the health situation and needs for care with the LGBT population beyond the HIV and the prevention of sexually transmitted infections within the framework of integrated network of health services and the recently established National Program of Care provided to persons in greater vulnerability. We shall continue to work in order to improve access for all citizens of Honduras without discrimination, and we will stick to the necessary measures and recommendations that appear in said report in order to do away with the hurdles that impact the access of the LGBT persons to health services aimed at achieving universal health coverage. In connection with 10.8.10b, Honduras had just begun with its own digital transformation plan, adopted and adapted to its reality, integrated in the National Health Foundation Plan 2024-2030, which includes the digital transformation axis and the roadmap for the digital transformation of the health sector, with a plan of action for the implementation of the electronic file, the single electronic file, the implementation of the telemedicine in 4 or 5 regions in the country, the sustainability and the scalability of the IT system to manage logistical data of medicines and supplies for health, and to achieve interoperability of information systems in health that we're already working on. The health sector in Honduras is facing barriers such as the limited coverage of internet, the scarce familiarization with the digital tools, and the lack of technological health solutions. Regarding 810C, in Honduras, we've been working hard in order to strengthen our legislative framework on health, with the main purpose of improving access to equity and the quality of health services. We acknowledge that a robust legislation that is well implemented is essential in order to make sure that our citizens will be able to enjoy the right to health in optimum conditions. Amongst recent achievements, we have the National Plan for the Refoundation of Health 2024-2030, Strategic Institutional Plan 2023-2026, and the strategy in order to have institutional strengthening of integrated health services networks based on primary health care. We're moving forward on updating the health-related law and code, updating the national health model, reviewing the draft law for the national health system, the draft law on the telemedicine project, the development of the single clinical file. These reforms have been designed in order to deal with specific challenges such as the lack of resources in rural areas and the need for more specialized services. Thank you very much. Thank you very much, Honduras. In connection with this point, we have several non-state agents that wish to present a statement. That I now give the floor to the International Federation of Medical Students Associations.
Distinguished delegates, the International Federation of Medical Students Association recognizes the critical need to generate spaces in the different social spheres that are universal, inclusive, equitable, non-discriminatory, and follow human rights guidelines. We particularly highlight the urgency to develop and implement specific measures that allow LGBTQA+ community to exercise the right to health. Within our federation, we recognize the specific health challenges faced by LGBTQA+ individuals and the importance of strengthening the skills of the healthcare workforce in these issues to create an environment of common understanding and trust. Taking into account the problems of the various member states reflected in the progress report, we urge the lawmakers to adopt national policies that ensure not just non-discrimination, but furthermore, an equitable approach for all LGBTQA+ individuals, considering the different social problems they face. We call the national health policymakers to collect robust data on obstacles and challenges that the LGBTQA+ community face in accessing healthcare services through meaningfully involving civil society organizations to further develop strategies that tackle these issues. Ensure inclusive and safe spaces in health services for the LGBTQA+ community through the national regulations and framework that rejects discriminatory practices and support values of respect, empathy, and understanding. Expand mental health services and violence and stigma prevention initiatives that mitigate the consequences of minority stress and non-supportive societies that continue to jeopardize the health and well-being of the LGBTQA+ people. Implement programs and initiatives that aim to train healthcare workers and students in the knowledge and skills necessary to provide services for LGBTQIA+ patients sufficiently, responding to their unique needs. We must acknowledge that the LGBTQIA+ individuals not only seek prevention of HIV and other STIs, but have comprehensive health needs, only facing more challenge to meet them. Thank you.
Muchas gracias.
Thank you very much to the International Federation of the Medical Students Associations. And now I give the floor to the Caribbean Coalition.
Agenda item 810C. The HCC applauds this progress report on the strategy on health-related law and its recognition of the advances in laws and regulation to foster healthy environments, the establishment and strengthening of mechanisms to harmonize regulation, to build regulatory capacity, including the development of health legislation databases, and the formation of networks such as the Caribbean Public Health Law Forum, a multi-stakeholder platform which builds legal capacity to support accelerated public health law in CARICOM. However, progress in health-related law has been negatively impacted by industries producing and promoting health-harming products due to the absence of regulatory guardrails to protect public health policymaking from undue influence. Weak governance, in particular the absence of laws to address conflicts of interest, including freedom of information legislation, presents the greatest barrier to the regulation of commercial actors and NCD progress. Institutionalized, unregulated multi-stakeholderism has created unrestricted private sector access to policymaking spaces where power imbalances are exacerbated and commercial interests continue to prevail. CARICOM's recent failure to approve the evidence-based octagonal warning label exemplifies the negative and sustained impact of industry interference. In the 2023 SIDS Bridgetown Declaration on NCDs and mental health, the commercial determinants were recognized as key drivers of NCDs, and it was noted that urgent action on those determinants was imperative for sustainable development. Madam President, as we look towards the 4th UN high-level meeting on NCDs, a major milestone and stock-taking moment, member states will be called on to demonstrate bold action to tackle the commercial determinants of health. We strongly recommend that in implementing the strategy, member states of the Americas, in particular the highly vulnerable Caribbean SIDS, with support of PAHO, strengthen public health governance through the promotion of regulatory tools which safeguard the process of drafting, implementing, and enforcing legislation from vested commercial interests. Thank you.
Muchas gracias.
Thank you very much to the coalition, Healthy Caribbean Coalition. And now I give the floor to the International Federation of Medical Students Association.
Thank you, Madam President. Regarding the point 8.10, distinguished delegates, the International Federation of Medical Students Associations supports the advancements outlined in the roadmap that recognizes the critical role of digital transformation in improving healthcare access, efficiency, and quality, especially in a region with social, structural, and geographical obstacles to healthcare. The IFMSA supports using digital tools and artificial intelligence effectively in medical practice and research, ensuring they are implemented ethically and inclusively. However, putting these strategies into action requires the active participation of young professionals and medical students. Our involvement is essential for fostering innovation and ensuring that digital health solutions are fair, sustainable, and tailored to the needs of various communities. Engaging youth introduces fresh ideas and empowers the upcoming generation of health leaders to play a role in the ongoing transformation of healthcare. We call governments, health organizations, and educational institutions to prioritize the engagement of young people in the conceptualization, implementation, and evaluation of digital health projects through supporting collaborative efforts that encourage ethical and meaningful practices. Invest in youth-led innovation and education in digital health as guaranteed pathway to progress that will help close gaps in healthcare access and ensure the digital evolution of health services for all. Respond to digitalization of healthcare through the implementation of digital health into medical curricula and education of healthcare professionals. ensure that technologies used in medical practice are free from racial, ethnic, social, and gender bias by adopting standardized protocols to robust data governance that aim to leverage technology for comprehensive health improvement for all, addressing the consequential disparities along the way. Digital health is a future, and so are young people. We must make sure that the future we highlight the vital role of youth in transforming healthcare and leave no one behind. Thank you.
Muchísimas gracias.
Thank you very much for all these comments. And now I give the floor to the Secretariat to respond to all these comments.
Muchas gracias.
Thank you very much to all who spoke in connection with the various topics. And let me reply first in connection with A, addressing the causes of disparities in health services access and utilization for LGBT persons. Thank you very much to the U.S., Panama, Brazil, Honduras, and the Students' Federation. We have seen, and you've read the report showing that there is progress. Progress has been made in connection with access to services, but they're limited. We still face many hurdles. There are huge gaps between access not only to health services, but to health in general among the different populations. Even LGBT persons is not a heterogeneous population, and that's something that is very important to be taken into account. The Secretariat will continue to work with you in order to eliminate the barriers, the discrimination that still persists in health services. Thank you for your suggestions in connection with training and working with health personnel on these issues to bring down those barriers, not only in providing access to health services, which obviously is essential, but also the fact that these are services that go beyond. And Honduras said this very clearly, beyond HIV, because many times that these programs are boiled down to programs that have to do with sexually transmitted diseases. But beyond this, to avoid active participation of these persons in the design of health policies and programs, we should work in order to improve access to health through better laws and policies to truly be able to guarantee human rights and achieve equity in health and inclusion. The idea put forth by Panama in order to create a space and to reflect the best practices, as I heard the good practice that was brought up by Brazil, I believe that it is very important to emphasize what is the positive things that are already working and that can support. In particular, I'd like to thank Canada for the support, significant support that we've received in dealing with this topic, with this area, and also to the U.S. But Canada has truly been a very significant partner in all this work. This is in connection with A. With your permission, Madam President, I will immediately move on to item C.
Very much, United States, Honduras, the Caribbean Health Coalition, for your input on and for your comments on health-related law. Again, this is essential. We know that without strengthened legislation and underlying legal and regulatory functions, it's very, very difficult to advance in all the public health areas that we have been talking about this week. So the Secretariat will keep supporting the member states in strengthening the capacities, the legal and regulatory capacities of our member states as part of the essential public health functions, actually one of the essential public health functions that most behind, but also related to, as we were hearing, emergency. It's not the time when there is an emergency to have to develop new legislation. Thank you
you asked for those comments, but also related to chronic diseases, and we recognize very strongly the commercial dimensions of the social determinants of health. This is an extremely important area to work on, where we need to be strong in our legislations, and we have discussed this yesterday in depth. So again, also we're going to keep supporting the close work between the ministries of health and the national congresses and parliaments. That relation is extremely important to advance in this area. So please count on your Secretariat for the continued support on all the public health agenda needs related to legislation, and also to advance and to guarantee the right to health for everyone. Thank you.
Madam President, with your permission, I do have a couple of comments to make in connection with 8.10b. First of all, I'd like to express my gratitude for the comments received from Brazil, Bahamas, Honduras, and the International Federation of Medical Students. In a report that points out to one of the areas of greatest growth and acceleration in the progress that we presented as a region, and which refers to the very clear commitment that we have with this digital transformation of the health sector, which implies understanding that health for a long time was lagging behind, not having access to this digital transformation that has been going on in the different countries for over 2 decades, and that it is high time to position health as one of the strategic agendas within the government digital transformation in our countries. The report points out a significant progress in countries in the region, which is obviously supplemented by some of the comments that were made. The establishment of roadmaps or specific plans within national agendas in connection with this issue is essential. And in here, I'd like to commend Brazil for this clear planning that you have and this clear guidance to digital transformation services, but also because this is the first country that establishes a specific structure within the Ministry of Health in order to deal with information and digital transformation issues such as the Information and Digital Health Secretariat. Also to talk about some of the major elements that ought to be prioritized. For example, connectivity, where we have significant progress, and we heard about the examples in Bahamas in order to increase connectivity in health. And with this, to bring about significant benefits for the provision of services in order to generate data and for the contact that we have on a permanent basis with the health system and the citizens. We'd like to stress that there's not one single solution. There's a blend of solutions that offers these opportunities. And this leads us into facilitating telehealth services to be provided to our citizens, bringing services to areas where we don't have a sure access because of geographic barriers or different barriers, or to bring specialized services in those communities through contact with hospitals that have greater resolution. This is part of what has been prioritized from technical cooperation in developing a package for telehealth all-in-one, where we can find technical guides, specific tools for the design and implementation of telehealth programs in national contexts, tools that measure in order to understand if institutions and establishments are ready to implement telehealth services, and also the platform, the IT, the software platform, in order to bring one more real, viable possibility complementing these health services. In the last few days, what we showed in the telehealth stand is the availability of medical digital equipment that is enabled in order to provide health services, and they're available already through the funds of the organization, the strategic fund that can bring this closer to those countries that so requested. We also made significant progress on something that is a very clear priority, which is the creation of digital public goods. And in there, 17 countries implemented during a very complicated period of the pandemic, the digital vaccination certificates. And this leads us to prioritize all the other certificates that are linked to immunization and vaccination processes that are routine schedules, and also to use this in order to bring the information closer to the citizens, but also to have vaccination records and more accurate records that will help us guide very specific actions on the strengthening of the strategic area. During this period, we had great lessons learned among countries, and I stress that the Latin American Network for Strengthening of Digital Systems relaxes this network where all countries can precisely share the progress made, the challenges and the solutions that have been established. And I'd like to thank the U.S. and in particular USAID that has supported this initiative for over 10 years, which is an essential part of this environment shared among countries in the region. And last but not least, in order to conclude with the progress in order to deepen digital literacy as a key area, not only for the component in training and creation of new generations, defining the skills, the abilities that must be present within study programs, study courses in institutions that train human resources for health, but also as a permanent effort with health workers so that we can ensure that the benefits of this digital transformation will be for all. And with this, I conclude my comment by expressing our gratitude for the support for this initiative and promoting these actions so that they will lead us not only to accelerate but to transform these steps into something concrete in the digital health sector. Thank you. Thank you to the Secretariat for responding to these comments. Director, do you have any comments? Yes, Madam President, very briefly. First of all, I'd like to thank and acknowledge the progress that countries are making on these three issues that were presented, where we had these progress reports, and at the same time to clearly identify what the bottlenecks that we face are and how we can improve our technical cooperation so that during the time that we still have ahead of us, that we be able to respond to these challenges and to be able to attain all the commitments and the indicators that are therein established. They're very good suggestions on what can be done in order to move forward. The issue of disparities regarding access and the utilization of health services by lesbian, gay, bisexual, and trans persons. We know that this is a group that lives in a situation of high vulnerability with all these barriers to access to services for many diseases and violence. So we must have an integrated view, as Jerry pointed out, and we're not only talking about HIV/AIDS, we're talking about barriers that prevent access and that lead this population, these persons that are uniquely vulnerable, face many difficulties in finding access for everything they need, for chronic non-communicable diseases, and for all the other issues of mental health, with this look, this vision based on people, we have to look for this broader response. Now, in connection with the digital transformation, the director for the department, Sebastián García Saizó, has well discussed the progress that has been made so far, but how we need to further strengthen technical cooperation, because what was really good became a priority for all countries in the region, and we have to make the best of the moment in order to support with the digital transformation that will bring down barriers, that will expand access, and will improve the quality of health services.
And in terms of legislation, we are working with many countries on many topics. Some countries are bringing about changes in their health system, and we're supporting them with studies, technical options, so that they can improve their legislation. We also are supporting countries in the Caribbean.
In the Caribbean to to update their legislation on mental health. That is very important because in many countries in our region, the mental health care was totally focused on hospitals isolation in specialized hospitals that does not respect the human rights of these persons, and that's provide a total lack of connection with their families, their communities, and sometimes bring no progress at all for these patients. So I think that we are also working with the countries, and I want to thank many countries that have requested our support on this regard. Another topic also is the health promotion. Sometimes when I'm going to the countries, when I can, I am having meetings with the Congress, the Senate, and telling them that sometimes a law can promote health. If they make a law that will, for instance, eliminate the out-of-pocket payments as they approved in Belize, and I send a letter to congratulate Belize, or to make universal access to primary health care, like they are doing in Chile, but in Chile they needed to have a law because it was a presidential decree, or they are changing the law to reduce the use of tobacco. They are promoting health. So I think that it's very important to have this dialogue with the Congress, because sometimes I think that they can be, and they are a very important ally to advance health promotion and the transformation of the health sector. So thank you, Madam President.
Muchas gracias, Dr. Barbosa.
Thank you very much, Dr. Barbosa, for your comments. I'd like to inform the Council that the discussions will be reflected in the final report. Let's now move on to the next item, 811, resolutions and other actions of intergovernmental organizations of interest to the Pan American Health Organization. Sub-item A, 77th World Health Assembly. I'd like to draw the Council's attention to document CD 61 INF 11A, and I invite Mr. Nicolas Lagomarsino, Senior Advisor of the Governing Bodies Office of the Pan American Sanitary Bureau, to come to the head table. Thank you, Nicolas. I now invite the representative of the Executive Committee to report on this item. Thank you very much, Madam Chair. The Executive Committee received a report in June on the resolutions and other actions of the 77th World Health Assembly and the 155th session of the World Health Executive Board, considered to be of particular interest to PAHO. It was pointed out that 3 of the seats on the executive board held by member states from the region of the Americas would become vacant in 2025. Thank you, Madam Chair. In this manner, I conclude my report on this item. I now invite the Executive Council to take note of this report and comment on it. I call on the plenary to begin the debate. I call on Brazil. Thank you, Madam Chair. The 77th Assembly of the World Health Assembly approved a resolution on social participation for universal health coverage. And on the 28th of May, 2024, the resolution is very important to strengthen democracy and guarantee human rights worldwide. Brazil has a great deal of experience in implementing social controls over the decade, is very proud and can say that during the development of the resolution, we promoted different sectors of society through the National Health Council. We therefore understand that we need to provide effectiveness to the implementation of this resolution, particularly in the Americas. Brazil's experience could be very helpful to other countries in the region. That's why we participated in the meeting of the Executive Council of the Pan American Health Organization, and we enthusiastically received the expression of PAHO through Dr. Jarvis Barbosa, the director of the organization, as well as comments made by other delegations through this participation. In Geneva, when the seventh Health Assembly took place, we saw the need to implement this resolution throughout the country, and Brazil is therefore willing to help build a regional plan for purposes of implementing this resolution in the area of social participation and universal health coverage and well-being in the Americas. We are open to cooperating in building this plan, establishing the plan, a plan which, in our opinion, should involve the participation of other countries in the continent as well. We therefore suggest that there be monthly virtual meetings on this topic beginning this month of October 2024, and then an in-person meeting in the first quarter of 2025. And we are very happy to offer to host an in-person meeting in Brazil. Thank you very much. Thank you, Brazil. I now call on the United States of America.
The United States was pleased to collaborate with member states from the region of the Americas to contribute to the successful outcomes of the 77th World Health Assembly. The United States is grateful for its strong regional partnerships that led to successful finalization of the 14th General Program of Work, the package of amendments to the IHR, preserving longstanding procedures for admitting organizations into the framework for engagement with non-state actors, and extension of the work of the Intergovernmental negotiating body to develop a pandemic agreement. We commend Peru for its leadership on climate change and health resolution, which the U.S. was proud to co-sponsor. Climate change and health represents an essential priority, especially in the Americas region, and we look forward to bridging the progress of both climate and health work streams. We also thank Barbados for its leadership in chairing the WHO Executive Board for the coming year and its role as a co-facilitator in this year's just concluded UN General Assembly high-level meeting on antimicrobial resistance. We were pleased to co-sponsor the WHO resolution on this topic. While we applaud our shared achievements, we nonetheless remain concerned about increased politicization of the World Health Organization. The critical work conducted through the Assembly allows us to make collective progress on vital health matters. We appreciate PAHO's ongoing efforts to support the region and to look forward to continually actively participating with our fellow member states of the Americas in these critical WHO governance meetings. Thank you.
Muchas gracias.
Thank you, the United States of America. I now call on Mr. Lagomarsino to respond to the comments.
Muchas gracias, señora Presidente. Buenos días.
Thank you, Madam Chair. Good morning. Thank you to the delegate of Brazil. We take note of his offer, and we completely agree with what Brazil and the rest of the region can contribute to the implementation of social participation resolution, and we will work with you and all governments on this topic.
Highlights the achievement, how the region came together. I happened to be there, and it was a really hard work of the region, and also Barbados as chair of the executive board. It was also a difficult session, so I think we completely agree, and it was a very important session of the Assembly, but still there are challenges ahead, and we note that. Thank you very much. I don't have any further comments, Madam President.
Muchas gracias.
Thank you very much, Mr. Lagomarsino, for responding to these comments. Mr. Director, do you have any comments? Yes, I do, Madam President.
I think that it was very important to have the many resolutions that were proposed or supported from our member states approved during the World Health Assembly. Yesterday I mentioned already, but I just want to highlight how important to us that the WHA approved the amendments on the international health regulation. It's not easy, are complex issues, and I think that it was a remarkable moment of the World Health Assembly to have the consensus about the amendments. We also had other resolutions like that was mentioned by the delegate of Brazil. The delegate of Brazil, I want to recognize that Fernando is the president of the National Council, Health National Council, Conselho Nacional de Saúde from Brazil. That is I think that a unique council that you have in our region with the characteristic that it was established by a national law after the Constitution and brings together the Ministry of Health, the Secretary of States and Secretary of Health of the states, the municipalities, representatives from the healthcare workers and also from the community. So it's a kind of very interesting. I know that in other countries they have a health council in Mexico, they have one in Argentina, they have one, but with different configuration. So I think that is very important because this resolution that Fernando mentioned is to encourage the social participation, and we have discussed it so many times that for the patient safety, for the quality of services, for many important things, the people that use the health service, they need to be part of the conversation from the beginning. They need to be there during the planning process, they need to be there monitoring the outcomes so they can improve the outcomes of the health system. So I really appreciate this generous offer from Brazil to support all the countries. Another important thing was that we had 3 meetings of the GRUA with the heads of delegation during the World Health Assembly. We will keep this next year because it's important to share information, not only the meeting that we had before, just to have an agreement about the authorities for the World Health Assembly, but we had the opportunity to share information, to exchange, to facilitate the dialogue among our member states. And we had also a very interesting session about the pandemic fund that the Minister Anthony from Guyana participated and shared the information in many countries. I think that he made interventions and made very good suggestions to be considered to improve transparency, the governance of the pandemic fund. So that's it. Thank you, Madam President.
Muchas gracias, Dr. Barbosa.
Thank you, Dr. Barbosa, for your comments. I now would like to report to the Council that this discussion will be reflected in the final report. Let's move on to the next item. Again, item 811. Resolutions and other actions of intergovernmental organizations of interest to the Pan American Health Organization. Subitem B. 54th regular session of the General Assembly of the Organization of American States. I'd like to draw the Council's attention to document CD 61, INF 11B, and invite Mr. Luis Jimenez McGinnis, Director of the Department of External Relations, Partnerships, and Resource Mobilization, to come to the head of the table. Thank you. And I now invite the Directing Council to take note, to comment on this report and provide any comments it deems pertinent. I open the floor to the plenary for discussion.
Cedo la palabra a Bahamas.
I call on the Bahamas.
Madam President, the Bahamas acknowledges the relevance of the resolutions and declarations adopted during the 54th regular session of the OAS General Assembly. We commend the focus on critical regional health priorities, such as health emergencies, mental health, access to telemedicine, and addressing disparities in health services, including the prevention of discrimination against LGBT persons. We emphasize the importance of advancing collaboration between PAHO and AOS in areas like climate change, the health of migrants, and disaster response. The inclusion of these health-focused mandates in the OAS agenda is vital for achieving sustainable development and resilience in the region of the Americas. Madam President, the Bahamas supports and encourages continued dialogue and joint action between the two organizations, to ensure that health remains central to regional development initiatives. In particular, the integration of equity in addressing social determinants of health is crucial to ensuring that all populations, especially vulnerable groups like migrants, indigenous communities, and small island developing states, benefit from these policies. The Bahamas supports the implementation of these resolutions and calls for ongoing coordination to strengthen health systems and ensure that regional health priorities are adequately funded and implemented. I thank you.
Muchas gracias.
I thank the Bahamas and now call on Mr. McInnes to respond to the comments.
Muchas gracias, señora presidenta.
Thank you, Madam Chair.
To Bahamas for the comments. I will just mention briefly, again, to thank OAS member states for ensuring that there is that coherence and collaboration with the work of PAHO, and for that we are very much grateful on all the themes that Bahamas has mentioned, from climate change, inequities, indigenous peoples, health. And the second thing I would want to thank OAS member states is also for ensuring that health remains central in the work of the OAS, just as it is in this institution. Obviously, now that we have moved beyond from the pandemic, it is often difficult to ensure that health remains a central focus outside of those working in the health sector. And through the collaboration from OAS member states, we have ensured that is the case. So thank you, and back to you, Madam President.
Muchas gracias.
Thank you for the comments. Would the director like to make a comment?
Just to tell you that we continue keeping our good relationship with the OAS. I went there to present my report, and I think that it's important to call the attention of the ambassadors about in the countries represented there in the General Assembly about the main topics related to health in our region, and that we are also keeping that briefings with the ambassadors that are the representatives of your countries in the OAS and at the OAS, so we can keep them, I think, that engaged in this discussion, because sometimes it's very important to have the Ministry and the Minister of Foreign Affairs as a very strong ally of the Ministry of Health. So we are keeping this because it's important to have these missions here in Washington and to have them as also to support the very important discussion that we have had in this directing council, for example. So thank you, Madam President.
Muchas gracias.
Thank you, Dr. Barbosa, for your comments. I'd like to inform the council that the discussions will be reflected in the final report. Let's move on to item 811, resolutions and other actions of intergovernmental organizations of interest to the Pan American Health Organization. Subitem C, subregional organizations. And I draw the attention of the council to document CD 61 Inf 11C and invite Ms. Piedad Huerta, head of the country and subregional coordination of the Pan American Sanitary Bureau, to come to the office. I yield the floor to the representative of the Executive Committee to report on this item. Thank you, Madam Chair. The Executive Committee received a report in June on the resolutions and other actions of various subregional bodies that were considered to be of particular interest to PAHO. The committee was informed that in order to harmonize and strengthen PAHO's subregional coordination A new approach to the management of such cooperation was implemented in January of this year. It was pointed out that the alignment of public health priorities at all levels allows those issues to remain high on the political agendas in the region. Thank you, Madam Chair. This concludes my report on this item. Thank you, Madam Chair and representative of the Executive Committee. I now invite the Directing Council to take note of this report and provide any comments it deems pertinent. I open the floor to the plenary to begin the discussion.
Cedo la palabra a Bahamas.
I call on the Bahamas.
Madam President, the Bahamas notes the report on subregional organizations and the Bureau's continued efforts towards integration mechanisms. PAHO's long-standing history of stellar technical support in the region is supported by strengthening the strategic political approach, assisting member states with driving progress at all levels. The Bahamas, a member state of PAHO and CARICOM, lauds this organizational intersectionality as it creates a framework for focused, multidisciplinary, and diverse knowledge and information sharing. The annual convening of COSOD, the Council for Human and Social Development, allows for tackling prominent issues. The Bahamas is especially proud of the progress made at the 45th regular session of the COSOD on the successful signing of the Declaration of Nassau during Vaccination Week in the Americas 2023, which demonstrated a regional commitment to protecting children from vaccine-preventable diseases. The COSOD also provides for the inclusion of regional entities and agencies such as CARFA, PANCAP, and the Global Fund, to name a few. CARICOM, through CARFA, ahead of the International Cricket Council T20 World Cup, introduced a surveillance and monitoring tool designed to be used during mass gathering events. The Bahamas intends to join sub-regional counterparts in utilizing the tool for our annual Junkanoo festivals and other mass gathering events. We are strengthening our capacities in the region by sharing collective and vexing challenges for comprehensive solutions. The Bahamas supports PAHO's commitment to sub-regional organizations and looks forward to continued participation and progression in the Caribbean sub-region. Thank you.
Muchas gracias.
Thank you, the Bahamas. On this item, the Council of Ministers of Health for Central America and the Dominican Republic would like to make a statement.
La Secretaría Ejecutiva.
Thank you, Madam Chair. The Executive Secretariat of the Council of Ministers of Health appreciates the report on integration, regional integration. The work done by the Pan American Health Organization allows us to strengthen the key role of integration. And this is a role that guides us in the Executive Secretariat, such as addressing challenges for the well-being and improving the regional health of the region. It's important to note that this week we've seen several systems, such as working towards eliminating diseases, strengthening the capacities of health systems, the definition of public policy instruments with a multidisciplinary intersectoral approach, and how to include health in all policies. We have a political tool that was received strong support from PAHO for SICA, where we are working towards integration. We're now developing a regional strategy for digital health, again, supported by the department. We're also developing a strategy to promote health, one of many others. The organization, the Pan American Health Organization, under this new structure, has allowed us to coordinate directly with the technical departments that are responsible. And we firmly believe that through this joint effort, we will be able to achieve the goals of sustainable development. And I reiterate my appreciation and thank you to Dr. Jarvas and Piedad Huerta and her whole team for the support extended by the Executive Secretary to the Council of Ministers. And we are committed to continue to work on these regional actions. Thank you, the Council of Ministers of Central America and the Dominican Republic, for their comment. Now, I call on Mrs. Huerta to respond to the comments. Thank you, Madam Chair. I thank the Bahamas and Comisca for their comments on this very important topic, which is the Subregional Integration Organizations. I'd like to reiterate the intention of the organization to strengthen technical cooperation at the subregional level in all regions of the Americas in order to move forward in developing health in the region and positioning the health care and health priorities in the Americas in the member states, and raising this priority to the highest level of public and political agendas, both in member states as well as in the various mechanisms for subregional integration, which basically are made up of the member states of the organization. These organizations, integration organizations, play an important role because they facilitate the adoption of resolutions to meet subregional needs, to provide a coordinated response to shared challenges in the area of health and through integration. PAHO recognizes the importance of these integration processes in moving forward our strategic objectives that have been approved by you. So we work in an integrated manner with these mechanisms in order to draft, update, and improve regional strategies for regional sub-cooperation. We have a cooperation effort with Central America, also South America, and in the Caribbean. We work for you and with your participation. As was said by motto we've heard very often, we acknowledge the openness and solidarity of regional integration, because together we can work better. As the fund says, together we are stronger. Thank you very much. Thank you very much, Mrs. Huertas, for responding to these comments. Mr. Director, do you have any comments? Yes. First, I'd like to thank countries for the great cooperation we've received from all the subregional integration organizations with Mercosur, with the pro tem chairman, which was Paraguay at the time at the meeting in Mercosur in Asunción. We were able to participate. We also participated virtually with the ministers of health of Central America when they had Comisca's meeting. And yesterday, in fact, we issued a memorandum of understanding with the organization on the Treaty for Amazonic Cooperation, which includes 8 countries that are part of the Amazon Basin in Central America. Also with CONA, we're working on very productive discussions. And
The Council participated in the COSOD meeting and had a specific meeting with the Deputy Secretary General of CARICOM. And I do believe that working together with the sub-regional entities is crucial to improve the health in the Americas. For many specific topics that we have in South America or Central America or the Caribbean countries, I think that these sub-regional mechanisms are a fundamental platform to ensure solidarity, cooperation, and to make advances in our agenda. As Piedad Huerta mentioned, we are in the process to finalize the sub-regional cooperation strategy with a very intense dialogue with the member states, the countries in each one of the sub-region, but also with the mechanisms. So I think that we will have in a couple of months, maybe at the beginning of the next year, we will sign these agreements, and I think that there will be a very concrete roadmap to identify what are the priorities that we will work together with our brothers and sisters from this sub-regional mechanism. Thank you, Madam President.
Muchas gracias.
Thank you very much, Dr. Barbosa, for your comments. I would like to inform the Council that the discussions will be noted in the final report. We now move on to agenda item 9, other matters. Director, would you have any other matter that you would like to bring to the attention of Council? No, Madam President, we had many matters, good, intense, in the course of these few days. Thank you. And now I yield the floor to any delegate who has something to propose under other matters.
Perfecto.
Perfect. Then let us now proceed to the next item, which is agenda item 10, the closing of this session.
Bueno, vamos a pasar.
Let us then move on to agenda item 10, which is the closing of the session. And in closing the session, I would like to invite the director to make some final remarks. Please, Dr. Barbosa. Thank you. Thank you very much, Madam President.
65th session of PAHO's Directing Council, Honorable Maria Teresa Baran, Minister of Health of Paraguay, Honorable Vice Presidents of Bahamas and El Salvador, esteemed Rapporteur Dr. Carla Marina Paredes Reis, State Secretary of Health of Honduras, esteemed President of our 174th session of the Executive Committee, Dr. Adriana Alfonso, Director General of Health of Uruguay, esteemed Derek Walton, WHO's Legal Counsel, who participated in the head table with us this week, our PAHO's Legal Counsel, Miguel Burnier da Silveira, who served as Secretariat ex officio of this Council, Honorable Ministers, Secretaries of Health of PAHO WHO member states, distinguished member states delegates, eminent members of the diplomatic corps, representatives of non-governmental organizations in formal relationship with the Pan American Health Organization, fellow PAHO and WHO colleagues. As we end the 65th session of the Directing Council of the Pan American Health Organization, I have a deep sense of fulfillment and commitment that you all have for this organization. During these past 5 days, you have successfully navigated through 46 agenda items, reviewed 3 progressive reports, 5 final reports, and approved 14 resolutions. On behalf of the entire Secretariat, I wish to extend my sincerest thanks and heartfelt appreciation to you all for your individual and collective contributions to delivering on this week's extensive tasks. Ladies and gentlemen, I would like to take a moment to briefly recapture the highlights of this week's deliberation. During this week, you discussed and approved vital resolutions related to policies, to climate change and health, a strategy and plan of action to decrease the burden of sepsis, a plan of action of strengthening information system for health, a strategy for essential public health functions, a strategy and a plan of action to strengthen tobacco control, a strategy on emergency, critical and operative care, and finally, a strategy on epidemic intelligence and health emergencies. We witnessed technical excellence in your deliberations and a smooth approval of the proposed mandates, which is a clear result of the consultative process conducted by the Secretariat. We held 5 briefing sessions during the week, one on elimination initiative, and we heard from member states on the implementation of innovations and best practices for communicable diseases in the Americas. Another was on the pandemic accord, where we heard the state of the current negotiations and timelines to agree on a final instrument. It was highlighted the key articles in the accord, including its global and regional implications. Another briefing session was on telehealth for all, where we discussed the opportunities for bridging gaps, enhancing care, and advancing equity. PAHO has put together telehealth kits to support member states in the implementation and expansion of their telehealth system as a way to strengthen primary health care. We also had a briefing session regarding WHO investment round, where we celebrated the Americas' contributions to a sustainable WHO. Our last briefing session highlighted the elimination of cervical cancer and how to change the trend of one of the main causes of death in women in our region. We have HPV vaccines, diagnostic tools for early detection and ablation treatment available through our revolving funds, and we can save the lives of more than 40,000 women per year in our region. Let me now switch to Spanish.
We also approved a resolution on the closing of our Latin American Center for Perinatology, Women and Reproductive Health, a CLAP in Uruguay, that will continue to provide technical cooperation to all countries on these key issues, but now from our headquarters here in Washington. The Secretariat presented the roadmap for the development of the 2026-2031 strategic plan that will set the course of technical cooperation on health for that period of time. The document to be presented in 2025 will include the best practices in strategic planning and management based on results, as well as the lessons learned from the current plan. You also approved incentives to the increase in regional production of vaccines, medicines, and other essential technologies within the framework of the charge that is collected for the procurement of health supplies. The member states adopted the use of the budgetary surplus in some technical programs that are key with insufficient funding. Member states also carefully reviewed the progress reports and final reports on a whole set of strategies and plans of action that are still underway or those that have already been completed. We all agree in saying that even though we continue building on the basis of our collective successes, there's still much to be done in order to address persistent challenges. I wish to bring a special words of gratitude and profound recognition to our President, the Honorable Minister Maria Teresa Baran from Paraguay, for the firmness of which she has presided in a very efficient way this 61st session of the Directing Council of PAHO. Thank you very much for keeping us on the path in order to complete the agenda for this week with respect, courtesy, and kindness. I also wish to express our most sincere gratitude to the President of the 174th Executive Committee, Adriana Alfonso, Director General of Health in Uruguay, as well as our Rapporteur, Carla Marina Paredes Reyes, Minister of Health of Honduras. I also wish to express our gratitude to our legal counsel, Miguel Burnier da Silveira, for his dedicated work as a Secretary of the Directing Council, and to all our staff, including the Office of Governing Bodies represented here by the lead advisor, Mr. Nicolás Diego Marcino, and his team for their tireless efforts and excellent contributions, both during the course of the meeting this week as well as during many previous weeks. I wish to express my most sincere gratitude to our talented interpreters, without which we will not be able to carry out our work in a way that flows so fluently, and also to our translators that have made it possible to have all the documents for this meeting in the 4 official languages of our organization. Today, in bidding you farewell, I would respectfully wish to ask you that we commit ourselves to the Pan-American values of equity, excellence, solidarity, respect, and integrity. Once again, I congratulate each and every one of you for your commitment and excellence in the discussions that we had this week. May you have a good and safe return back home to your respective countries. Thank you very much to each and every one of you. And now, as is traditional amongst us, we will deliver this gavel to our president, the president of the council.
Para que se es necesario lo utilice en su casa.
So that you can use it at home should the case arise. Distinguished authorities, colleagues, delegates, and friends. To conclude, I wish to reiterate my gratitude for providing me the possibility of acting as president and for the confidence deposited in the hands of the government of Paraguay. I'm convinced that this joint work and the collective commitment are essential in order to overcome the challenges we face. I would also wish to express my gratitude to all the members of the Bureau, Carla, Adriana, Miguel, Dr. Barbosa, Nicolás, as well as all the directors in the various Pan-American offices for all the work that you've done here. It seems to me that this was a very intense week, but also extremely productive, where we bring back with us many lessons learned from all the countries. I ask each and every one of the countries here present to please share, because I've come to realize that many countries have strengths, but we also have weaknesses. So that we be able to share amongst all countries these strengths that we have, so that we can work on reducing the weaknesses that we have in our countries. We have to continue working and fighting, struggling for that so expected universal access to all health services for all countries. Thank you.
Paso la palabra.
Let me give the floor now to the Secretary for a couple of some last announcements. Thank you very much, Madam President.
Remind delegates that the 175th session of the Executive Committee will take place in Room B. All delegates are invited to attend the session. The Executive Committee members are Brazil, Canada, Chile, Colombia, Ecuador, El Salvador, Guyana, United States of America, and Uruguay. There's a 30-minute coffee break downstairs before we go.
12:15, they have to be in the room B.
Oh, sorry. The executive committee session starts at 12:15. Thank you.
Ahora declaro clausurada.
So now we formally close the 61st Directing Council of the Pan American Health Organization.